Namaste, and welcome to our continuing series on homeopathy with our beloved Dr. Pachegaonkar. Today we continue with the composition of the body, digestion, part 3.
When food is like churned in stomach and it mixes with the hydrochloric acid, it is sterilized, thoroughly mixed, then the digestion starts there, the breaking up of food. And then it becomes, we call it a chyme, CHYME. That becomes a sort of a juice which is mixture of the food and the juices mixed in stomach. And when it comes to duodenum, again the bile and the pancreatic juices secretions are added, so that their carbohydrates, proteins and fat, all the three components of food, they start getting digested with this. Not only that, duodenum has a capability of secretion which monitors the pH, the acid level, because in stomach there is lot of hydrochloric acid secreted. The pH of the content of the stomach would go up to even 2, which is quite acidic. But as soon as it comes to duodenum, by sensing its acidity or corrosive nature, the mucosa of duodenum secretes alkaline elements, which brings down the acidic level and makes it neutral, so that the duodenal wall, the mucosa, is not corroded by the acidity which is secreted in
So
stomach.
it's about 7 then?
It comes to 7. 7 is
see.
neutral. It
Yes.
should come.
Yeah.
So body has that mechanism. That's what we always say, that people who take vagus inhibitors, where the acid secretion itself is inhibited by taking internal medicine which affects the central nervous system, and that is not necessary. Body has that mechanism where in the duodenum the acidic element of the chyme or the food which enters there is definitely neutralized and the alkaline secretion is there. And once this is like digested properly, then it gets broken down, and then it proceeds to the next component of small intestine after duodenum, jejunum. And then in the duodenum and jejunum, always there are secretions. So many enzymes are secreted where the digestion takes place, and the essential ingredients of the chyme, the food which is digested, is absorbed. The water fluid is absorbed, the nutrients are absorbed, carbohydrates, proteins, fat, these things are absorbed and disseminated to the body through proper channel. And whatever remains again is passed on to ileum, that is the terminal part of small intestine, that is the longest part, and it is bit like a strong wall. Structure is much similar, but the functions differ. So whatever is remaining is absorbed in the terminal part, that ileum, and then it is allowed to pass to the large intestine for fecal formation, stool formation, and whatever extra fluid is there, that also is absorbed in large intestine, that is colon we call it. Now this ileum and colon has a junction, ileocecal junction what we call, and there is a strong sphincter. So food is actually stagnated in these segments of small intestine till everything whatever is necessary is absorbed, and then what is not necessary is allowed to pass further to the colon. And it's a wonderful, very intelligent mechanism, that the and of course the main role played by is the friendly organisms with the intestinal flora. And it is this ileum, the terminal part of small intestines, where our B group vitamins are synthesized with the help of friendly organisms. Because till it comes to ileum, almost 90% digestion absorption is over. Only the remaining part takes place in the ileum, and these friendly organisms, what we call, what they call it a probiotic action. There, the vitamin B12 or B group vitamins are synthesized in our own intestinal tract.
So one doesn't have to take B12 vitamin?
Yes, the one doesn't need to take, because body has mechanism to synthesize it. Only when nowadays what happens, by virtue of controlling so-called bacterial invasions, infections, people give antibiotics. The doctors prescribe antibiotics, which and in turn disturb the intestinal flora. And because of the disturbance in the intestinal flora of friendly organisms, the synthesis of B12 is hampered. And therefore, along with antibiotics, the doctors know that they anticipate, they foresee that there would be deficiency because of the disturbance of this probiotic action lacking, and they give B12. In normal case, you don't require external supplement. It is only vitamin C which is not synthesized in our body. Vitamin C is not synthesized in our body. It has to be readily given. It is a citrus fruits, lime or orange and amla. These fruits contain it, and that ready-made body gets it. Otherwise, B group, all vitamins are synthesized in our intestinal tract, and it is this small intestine, the ileum, where it is synthesized. And then the sphincter controls it then. The chyme, the fluid, is not allowed to pass further unless the absorption, digestion, everything is over. And once the system realizes that now whatever is needed is done, the nutrients are absorbed, the water component is absorbed, then it is allowed to pass further by opening the sphincter in the ileocecal junction in the colon, and then colon receives it. And then once colon receives it, then again so many organisms are there, friendly organisms are there, where the fecal matter is well formed, and water, whatever is there, that is again absorbed, and a very soft bolus of this fecal matter is allowed to pass through the intestinal colon, coming to the terminal part of it up to rectum. And when it is like conducive environment, then it is allowed to be evacuated. So this happens, the whole process of ingestion of food, then digestion, deglutination, digestion, then absorption with the help of all enzymes and digestive secretions like bile and all, it happens within like 36 to 40 hours till the fecal matter is excreted. What we call constipation, the bowel clearance, it's a very common complaint where it is what they call it unsatisfactory evacuation of bowels. You can't define constipation easily clinically. It is not easy. We have seen people who pass stools thrice a day. They still feel that they are constipated. Whereas there are people who pass stools alternate day or just thrice a week, and they feel they are not constipated at all, and this is the fact. So as a clinician, what we do is, there is no test to tell whether a person is constipated or not. So traditionally, what physicians used to do, they used to feed a charcoal powder in food, and just see how long it takes to empty it, because charcoal is not digested and absorbed. It is an adsorbent material, but it just passes further. Body won't absorb it as required. It has its different action, adsorbent action, but then it passes through stools. And if the person is able to excrete the charcoal within 74 hours, we consider that person is not constipated. So it may take even 74 hours, 72 hours to form the fecus matter and then excrete it. So this way, this digestive process, it's a very intelligent process. But so many disorders also are there. When there is sort of a dysfunction, there are disorders, and it's very complex that way. See, the intestinal coil, small intestine, large intestines, this in abdominal visceral space, there it's finely designed by our system. This mesenteric binding is there, it's a support. So all these intestines are well organized in our abdominal space, and there is called as omentum. Omentum is again a sort of a flap or like canvas like structure, a flat structure which covers and governs and protects the internal organs, these digestive organs. And we have seen, like I have seen a case where the appendix is a sort of a remnant organ. It doesn't have its function, but at ileocecal junction there is a hollow, what we call a mass, which is attached, and that mass sometimes gets infected, and then it may even burst open, which can lead to peritonitis, because it's a peritoneal cavity. If the contents of intestines get intestine getting perforated and contents getting evacuated in the abdominal space, then there would be chances of infection, peritonitis.
I had that very thing.
And our body has mechanism to even seal that even before surgeon coming into picture. What we call this greater momentum comes in action the moment there is perforation in healthy body. This greater momentum seals it till it is healed. It keeps it sealed. It is like a temporary bandage. The body does it, and this greater momentum comes and seals it. And we have seen some 4 years back one case where the boy had appendicitis, and we asked him to get subjected to this ultrasound scan, and the imaging person gave the report that it is a sealed perforation at appendix. Sealed perforation means this momentum had sealed it. There was surgeon was not required, and conservatively the boy recovered. So this greater momentum, then there is a lesser momentum also in between where it is protecting. So in the surgeons call it the police, which protects the organs in our abdominal wall. So this is there. Then there are some elements where, see, these intestinal contents, they go on passing further through the peristaltic movements, and sometimes because of erroneous unsynchronized peristaltic movements, the intestines can get intercepted. So one segment of the intestine goes telescopically to the other segment and gets stuck, and that interception, again, if it is not released immediately, then it may lead to even gangrene formation, because the blood supply, everything is cut, and it can be a medical emergency. But we have seen some cases where the person is being taken to operation theater, and somehow spontaneously the spasm is released and interception can get released. Then we have seen some cases where there is an intestinal obstruction. Intestinal obstruction can be because of the coiling of the intestine by the twist and all, by this interception also. And we have sometimes foreign bodies also causing intestinal obstruction. And this intestinal obstruction, if it is absolute in the sense even gas cannot pass, and then it is a very dangerous situation. If body continues to have it, it is, if it is not relieved surgically or spontaneously immediately, there would be even it will be fatal. And funniest part is there are so many causes of this intestinal obstruction. And one case I have seen, that these worms, roundworms, ascarids infestation, if you give deworming to the for the eradication of worms, those worms get paralyzed and they react oddly to this deworming dose. and they react in such a way that all worms come together and they form a ball, a spindle,
Ah.
as a reaction to the deworming dose. And when they form a spindle, that itself can cause an intestinal obstruction, which is again a surgical emergency.
How do you treat it homeopathically?
See, homeopathically, we always see that this life cycle of these worms, be it ascarides or roundworms or even threadworms, all these worms, their life cycle is very complex. So, if proper hygiene is maintained and if the environment in our intestinal tract is not conducive for harboring these worms, they won't thrive. Like generally, deworming, what it deworming does, deworming paralyzes the worms so that they just are passed further with the fecal matter and they are passed through fecal matter. Now, the lifespan of the worm is hardly few months, and anyway after a few months they are going to be perished. So mainly it is the multiplication of the worms which should be prevented. And here the worms don't multiply within our intestines. Their life cycle is complicated. Their eggs, ova and cyst have to come in stool and then get infected and then they multiply. So, if we are able to correct the environment in our intestinal tract, which doesn't continue to harbor worms, then it will be very effective. Otherwise, in tropical climate like India, you give deworming, the adult worms will be passed, no problem. But again, if by chance the ova and cysts get entry, they will again come and grow. There is no point in deworming otherwise, and deworming definitely is a medicine which has a toxic effect. Most of the deworming medicines are having hepatotoxicity. So definitely there would be liver function which will be hampered, and it is not long lasting solution. So you have to go on giving deworming doses to children, but generally we don't advocate. And homeopathy has wonderful remedies like herbal remedies like Sina in potentized form. If we give, we have Sina, then Felix Mas, Granatum. These are the plant medicines. If we give, they will cure the environment which harbors worm. So they will stop harboring, and presence of few worms should not be a problem at all for the individual. And if the environment gets cured, worms will be definitely be eliminated through fecal matter and person will not have worm infestation. So this is how we deal with it. Then there are certain conditions like appendicitis or hernia.
Yes.
Hernia, it's very common. Hernia also, there are two types. One is direct inguinal hernia and one is indirect inguinal hernia.
Inguinal.
The indirect inguinal hernia is through the inguinal ring. See what happens in males, the testicles originate in abdomen during the fetal development, and at the time of birth through inguinal canal the testicles travel outside and come to the scrotum. They descend to the scrotum at the time of birth. This is wonderful design, because for adult testicles, when one person attains adolescence, the testicles require 2-degree subnormal temperature for sperms to develop. And to achieve that, the testicles descend to the scrotum, so that if there is sort of a heat, summer heat, the testicles are away from the body. The scrotal sac hangs down to keep it away from the body. So 2-degree Celsius subnormal temperature is maintained for testicles. So testicles travel from abdomen, from internal side, and travel to the scrotum during development. And this canal through which the testicles travel, if that canal has a placid musculature around it, then the contents of the abdomen like intestine and all these starts herniating, and that is inguinal hernia. And sometimes that inguinal hernia through the inguinal ring, if it comes, there are chances that it gets strangulated. The contents come and go back, there should be no problem. It is not dangerous. But sometimes, because of coughing or straining or intra-abdominal pressure is increased, the herniation occurs, the internal organs herniate through it, and they get stuck. And they get stuck so much, what we call strangulated hernia, that even the blood supply is cut off to the herniating organs. And when it is, like in body, if there is no blood supply for a few hours, then there occurs gangrene, and that becomes a fatal event. And therefore, then again, that emergency surgery is warranted, surgical correction.
I've had two of them.
Is it?
And I also had my appendix burst on the operating table. Now, how does that happen? It bursts through the skin?
See, appendix is a hollow organ which is attached to the ileocecal junction, ileum and cecum junction. There is appendix which is connected to the intestinal gut, the opening. And if that gets infected and pus is formed, and then it gives it away. And then there occurs a perforation when it bursts open, and all intestinal contents come to peritoneal cavity, and it causes peritonitis. So burst open appendicitis gives rise to peritonitis, and that peritonitis, if it is not corrected naturally by omentum, as I said, greater omentum, or by surgical intervention, then it can become fatal.
Yeah, I was in great pain. I was in my early teens, and they had to do a lot of surgery. And in those days, the surgery was not the way it is today. It was pretty rough.
And in peritonitis, what happens if it is after bursting open?
Yeah, peritonitis.
Then you have to clean the whole peritoneal cavity quickly. And if you fail to do it, that peritonitis, if it is prolonged for say 10 hours, 12 hours, then there occurs a paralytic ileus, what we call. The intestines get paralyzed. Paralytic ileus, we call it. And once the paralytic ileus is set in, the intestines are paralyzed, you can't do anything. The prognosis is very bad. So the quick intervention has to be there, but the few people are lucky where the greater omentum comes and seals it. And we have seen, as I mentioned, that boy, hardly 15 years, and he had appendicitis, the chronic one, burst open, but omentum immediately sealed it. And immediately we subjected this child for sonography scan, and the imaging person gave the report that there is a sealed perforation. So body has done it.
Yes.
So it's a wonderful phenomena. The digestive system is such a wonderful design that what body needs, body gets. It's a procurement, storage, dissemination, distribution, and utility. And then body sends to the contents depending upon where it is needed, especially the liver. Liver is the main organ where it stores all these things.
Just an aside question. Is it similar in animals?
Much similar.
Much similar.
Much similar, because in cattle, they have a rumination facility. That's what we say, the appendix must be the rudimentary organ like that. And during evolution, the function ceased, and then it is not well developed in human beings. But in cattle and all, they just gulp the things, keep in one sack, and then while sitting they ruminate, and then the things go to stomach. But the process is similar. Yes, fecal formation, everything is very similar.
Thank you so much, sir. Namaste. Namaste all.